Hello, my name's Don Vernier, and I've been a registered nurse for about 20 years, and I also have a background in economics. And I think I've discovered something about the healthcare crisis that's been completely overlooked. And I believe it's the key to solving the healthcare crisis. The reason I'm putting this on YouTube is in the hope that we can spread it far enough and fast enough that it'll become recognized while we're still debating the healthcare, and perhaps we can keep our government from making a very costly mistake. So let's get started. The most important thing about solving the healthcare crisis is understanding the problem. Now, there are several things involved in the healthcare crisis, but the most important is inflation in healthcare costs. Healthcare is simply too expensive, and the prices keep going up so fast that it's placed an incredible burden on everyone. Insurance is too expensive. People can no longer afford it. Companies can no longer afford to cover their employees. People can no longer afford to buy the drugs that they need. It's a very difficult situation, and nobody seems to have the secret on how to bring those prices down. That's probably 70 or 80% of the healthcare crisis is simply that it's too expensive. But there are some other problems involved in the healthcare crisis. One is waste and inefficiency. I don't think anybody really knows how much money is wasted in the healthcare system, but I read one report from a government agency that estimated about a third of all the dollars spent on healthcare are wasted through inefficiency. The cost of medical technology is very high. That's one of the contributing factors to the high cost of healthcare in general. If you've ever been in an MRI or CAT scan machine, you know that this is pretty space-age technology, and the cost of it is high, even if they weren't making a profit on it. So that's one of the factors that contribute to the high cost of healthcare and the healthcare crisis in general. Then there's the cost of insurance and cost shifting that goes with that, because as the cost of insurance goes up, fewer and fewer people can afford to have insurance. But when they go to the hospital, they're not turned away, nor should they be. And they're taken care of, but their bills are paid by those people that have insurance. And that makes their cost of insurance go up, and then fewer people can afford it still. More people drop out that are treated, and their costs are added to those that are left with insurance, and it's a vicious cycle that drives up the cost of insurance faster and faster. This is another problem with the healthcare crisis, and one that President Obama, to his credit, is trying to address. I disagree with some of his methods, but I think his heart's in the right place. There are some other factors involved in the healthcare crisis, not major factors, but still noteworthy. One is tort reform. The high rewards that are given to people who sue contribute to the high cost of healthcare because they contribute to the high cost of malpractice insurance, so the doctors have to charge more, and that adds to the cost of healthcare in general. End-of-life expenses. I'm a critical care nurse. I've worked in ICU for many years, and I've seen firsthand many times that patients who have really no hope of survival, doctors have told them they have no hope of survival, still they insist on hanging on, and they absorb massive amounts of healthcare resources. They may be on ventilators, they may have expensive IV medications running all the time, they have maybe one-to-one care from a nurse. All this is very, very expensive, and it amounts to an abuse of the healthcare system and raises everybody's healthcare costs. This is a very difficult issue, but there is a considerable amount of abuse that goes on in this area. And then there's unhealthy lifestyle choices. A lot of people simply don't take care of themselves. People who smoke especially, and if they don't have insurance, they wind up being treated for all the medical problems that arise because they chose to smoke, and that adds to everyone's cost of health care. People who drink, people who don't control their diabetes, and the list goes on and on. However, the most important of all of these, as I said, is the inflation in healthcare costs. If we could somehow find a way to bring healthcare costs down, it would go a long way towards relieving the healthcare crisis. Inflation in healthcare is twice that of the general economy, and it's like compound interest because it grows exponentially like money in the bank, except unfortunately it's the reverse of that, it's cost. What is different about the healthcare market that makes prices go up so fast? What can we learn from a properly functioning market? Let's take the electronics market, for example. That's an example of a properly functioning free market. Electronics is a $100 billion a year industry. And it sounds like a lot, $100 billion, but it's only 1/20th the size of the healthcare market, if you can imagine that. It includes manufacturers of computers, cell phones, MP3s, televisions, et cetera, so it involves a lot of things. The prices of electronics continue to go down. I can remember, when about 10 years ago, or 15 years ago maybe, computers that can only do a fraction of what computers can do now cost in the neighborhood of $3,500. Now you can buy an excellent computer, much more powerful, for only $500. So these prices have been going down. Obviously, this is a market that's working correctly, unlike the healthcare market. Why do prices behave differently in electronics than in healthcare? Why do these suppliers of electronics keep lowering their prices? Electronic suppliers have an incentive to decrease their prices, because if they decrease their price, they sell more of their product, and it's actually more profitable for them to decrease their price than it is to increase their price. This is called price competition. And the reason price competition exists is because it's driven by what we call a thrifty consumer, or what I call a thrifty consumer. If you put yourself in the consumer's shoes, and most of you can because we're all consumers, you like to hang on to your hard-earned dollars. You work hard for them, you don't want to part with them, you want to keep them in your pocket so that you can use them for something else. So when you go out to buy something, you look for the best deal. You look for the lowest price and the best value that you can find. And suppliers of electronics have to cater to you if they want your business, so they have to offer you the best value. Therefore, if they lower their price, it's more likely that you're going to buy their product. This is the way the free markets work all over the world. But let's take a look at the healthcare market and see what happens there. In the healthcare market, the thrifty consumer is replaced as a decision maker by the doctor. And the doctor has a very different set of incentives. And this is going to be an exercise in empathy, because I'm going to ask you to put yourself in the shoes of different people and different entities involved in this market. So if you put yourself in the doctor's shoes, he's not particularly concerned with cost. He just wants to get his patient better as quickly as possible. Plus, he wants to protect himself, so he's not going to prescribe anything that's less effective than the very best. It may be something that's very expensive, it may be something inexpensive, he's really not concerned about that. He just wants to do the best job possible for his patient. And rightly so, that's what we expect from him. But now, let's step into the shoes of the supplier of healthcare. The suppliers of healthcare understand their market, and they know that the doctors who choose their product are not concerned with cost. Therefore, they know that if they lower their price, they're not going to attract any more business from the doctors, because the doctors are unconcerned with price. They're not going to be any more attracted to their product. They're not going to sell anymore. They are going to make less money if they lower their price. On the other hand, if they raise their price, they're not going to lose any business, because again, the doctors are not concerned with cost. They're not going to be driven away. They continue to choose their product just as they did before, and the business is going to make more money because they're charging a higher price. If you can imagine the inflationary force generated by having all the businesses in this huge industry operating with every incentive to raise their price, no reason to cut them, versus a typical industry where price competition is the rule. Imagine the inflationary effect of that